From Penn State Health, this is Ask Us Anything About the Flu. I'm Scott Gilbert. Every year, the flu is responsible for hundreds of thousands of deaths across the world. So it's not a mere nuisance. It's something to be taken seriously. Here today to talk with us more about the flu, give us some good information about it, is Dr. Jay Zimmerman. He's a family medicine physician at Penn State Medical Group-Elizabethtown, which is where we are right now. So thanks for having us here, Doctor. Let's talk a little bit about this year's flu strain, because, the flu is not the same every single year, right? The flu is not just simply the flu, but rather there are various strains that are prevalent each year.
Right. Every year the flu strain that is available, is around traveling, it changes. It has different forms, all the different viruses you may hear about, the different strains. H3N2 is this year's one that seems to be going around more right now, and from the labs that they're checking the different types.
And so that's referred to often as influenza A, but yet, like you say, that's just one of several.
Right. So when you go get your flu shot, you get the influenza A vaccine, and usually has different strains in there. So whether it's the H1N1 or the H3N2, and then you also get an influenza B in there. Depends on which flu vaccine you get.
And I've heard that H3N2, that strain you're referring to, based on its previous performance in other years, can lead to more severe disease. Is that a concern among providers this year?
Yeah, it certainly is a concern when we have something like that happen, and we have a historic worsening of symptoms, like when the H1N1 came out. H1N1 hadn't been seen for years, so a lot more people who are young and healthy would get it and be really, really sick. So
yeah, the big swine flu scare of several years ago,
correct,
as it was called, right?
Yeah.
All right, you're watching Ask Us Anything About the Flu from Penn State Health. Dr. Jay Zimmerman is here to answer your questions and mine about the flu, so feel free to add them to the comment field below this Facebook post, and we'll get you answers to those questions, whether you ask them live or if you ask them as you're watching this video on playback. We'll add those answers as comments here. Let's talk about the more severe complications that can result from flu. And we hear about some of those each year, but who's most at risk, first of all, of developing those complications?
Sure. When you think about that, the people that are most at risk would be the people with pre-existing problems like heart problems or lung problems. So folks with asthma, emphysema, COPD, or folks with congestive heart failure. Those would be people I'd be most worried about. Kids with cystic fibrosis. Interestingly enough, pregnant women are also a really high risk too. So we always recommend that they get their flu vaccine, and them getting flu vaccine can help prevent their babies from getting flu as well.
And I know that you are recommending to your patients that they absolutely get the flu vaccine if they're able to. We do hear that there are subsets of people who are not able to receive it. Who are they?
So that's a pretty small minority of people. It used to be that people with egg allergies couldn't get it, and now we find that it's totally safe to do. If you have somebody who's had some sort of very rare neurologic problem, Guillain-Barré or GBS, that'd be somebody who shouldn't get the flu vaccine, but otherwise it's pretty widespread that you can get it.
And of course the effectiveness of that vaccine varies widely from year to year. Why is that?
Yeah, so that's a great question, and so part of the reason why it varies so widely is that we never know exactly which strain is going to be around, so we make the best predictions, and so we usually use the southern hemisphere, so Australia and other countries in the south, to predict. And so like this year, the H3N2 in Australia was really big, and I think it was 2 years ago about 90,000 cases documented, and this year jumped up to about 150 or 160,000 cases. So that is a big increase, and we're seeing the H3N2 in the United States here. Will it be as bad? We don't know, because we don't know how everybody's going to respond to it, but the flu vaccine's made the same, so hopefully we'll get a good response for those folks that get the flu vaccine.
And there are some early indications that this year's flu vaccine may not be effective in fully preventing the flu. Is that right?
Yeah, that's right. So the data from Australia kind of says that it wasn't as effective for the Australians, and assuming it's pretty similar here, that would be the best guess.
So a lot of people thinking, then why should I bother to get the vaccine? There are actually several good answers for that, aren't there?
Yeah, absolutely. So even if it's not good, it's still better than nothing. So most people, they might get soreness at the site of the shot, but otherwise they do really well with the flu vaccine. And if it helps prevent you from getting the flu or making it so it's not nearly so bad, that's something I certainly would recommend for all my patients.
Why is the misconception out there that the flu shot can actually cause the flu? I'm sure that's something you hear.
That's a great question. That's something that we hear all the time. Chances are they probably picked it up at the same time and just happened to get in, and they feel like it's linked to it. But I've certainly seen patients who are utterly convinced, and then I can't convince them to get the flu shot, unfortunately. But I think just people kind of feel a little bad and a little achy afterwards, and that can make them feel like they have the flu or they're worried about it. And if you've ever had the flu, you feel like a train wreck. No. In the worst case, you feel like you're run over, and that's not what the flu shot gives you at all. You may feel a little bit sore and achy for a day or two at most, from what I've seen.
That's not a bad trade-off for what the flu itself could cause, though.
Correct. And all my patients who's ever had the flu, they will get the flu shot every year after that. Every year. They'll say, I would rather take my chance of only 10% effectiveness if I can prevent that.
Right, or even lessen the symptoms, right? Because as you mentioned, it may not, even if it doesn't prevent the flu, it may help to mitigate the symptoms.
Correct. So your symptoms might be a little more mild. You might not have the high fever or not as many aches. The headache might not be so bad. Absolutely.
You're watching Ask Us Anything About the Flu from Penn State Health. Dr. Jay Zimmerman here welcomes your questions as we come to you live from Penn State Medical Group-Elizabethtown. We have a question from Pearl. She asks, once you already have the flu, do you need to have the flu shot? I'm not sure if she means in a given year or if once you've had the flu. Obviously, if you, like you just mentioned, if you get it 1 year, you still should, especially if you get the flu 1 year, you should still get the shot in subsequent years.
Sure. So a lot of my patients come in and say they have the flu already, and I ask them what kind of symptoms they're having, and they talk about the stomach flu. And I said, well, okay, that's very different than the flu vaccine that we're giving. The flu that we vaccinate for is respiratory, so lungs, breathing, cough, headache, high fevers, chills, not the stomach bug, stomach flu. So a lot of people think those are the same things. But if you have the flu, yes, you should still get the flu vaccine, because usually flu A goes around first, and then a couple months later, flu B comes around. And so you can still get some protection from flu B then, if that's the case. And we don't know if your strain was the same one that we're vaccinating for or not. And every time we get you the vaccination, your body's going to develop a response. And then next time the flu comes around, it can fight the flu better.
Mm-hmm. And it goes back to the fact that there are different strains out there, and you should protect yourself against all of them. But the stomach flu is not a strain of influenza. It's a virus, but not a...
That's correct. A lot of times the stomach flu is not influenza per se. There are many viruses in the U.S. that cause that, but yeah.
All right. Well, thank you for that question, Pearl. Our next question is from Christina. She says, how long does the flu shot last? That's an insightful question, because I think some people are afraid of having it too early. Is there such a thing?
Yeah, so I mean, a lot of people are worried about that. So we do see, a response in the body to the flu shot. Your body starts making a response to the flu, and that does kind of increase pretty quickly in the first number of weeks, 4 to 6 weeks. But it takes about 2 weeks for it to kick in. So the problem is that if flu starts going around and then you go get flu shot and then you get the flu the next day, it's not going to help you. So it takes 2 weeks for this flu shot to start working the system. And your body actually creates this type of response that if it sees it again, it should then be able to trigger a response anyway. So there's not such a thing as getting it too early.
I have 2 small children at home, and they really miss the nasal flu mist. Remember, just a couple years ago, but then it was pretty much deemed to be highly ineffective last year, and they haven't really figured out how to make it effective, right?
Correct. So, I love the flu mist vaccine. I thought it was a very good thing when it first came out. The studies look pretty good. It's painless. You might get a little runny nose and that sort of thing, and that's what I was getting because I thought it was the best, and then found out that it doesn't seem to be as effective as the injection. So because of that, the major bodies said that, we shouldn't give it to anybody. And so now I think they're not even making it anymore.
Some people may say, well, I don't need to get the flu shot because I'm relatively healthy. If I get the flu, it's probably not going to be that severe of a case. But can you talk about the importance of getting vaccinated to help protect those who are not able to get vaccinated?
Right. So, I hear a lot of that. Oh, I'm never sick. I'm always healthy. Yeah. That's fine. That's great for you. And you may have mild symptoms and go on and go to work and go to the store and that sort of stuff. And all those people around you who don't have that same immune response, they can't protect themselves the same way. So, with your kids, obviously, if you don't get the flu or your flu's more mild, you're less likely to pass it on to them or them pass it on to you. So, yeah, certainly if you're caring for somebody who's elderly or has one of those lung conditions, or has young kids or is pregnant, then it's really a good idea for you to get the flu shot as well.
We welcome your questions for Dr. Jay Zimmerman as we broadcast live from Penn State Medical Group-Elizabethtown for Ask Us Anything About the Flu. Some really good information, very timely too, because we're in December right now and we're heading into the holidays. But when does flu season typically peak?
So that varies year by year. So with the swine flu, it was September once the kids went back to school. But, typically we usually see it. Last few years, it's been much more almost February and March, although I think we're starting to see a big uptick now in the states. 4 different states, I think, have already declared that it's at full activity, and I'm not sure where Pennsylvania is on that right now. But
Pearl has a follow-up question asking about how early in the season should you get the flu shot. And she's also asking, when is it too late to get one? So I know you mentioned it takes about 2 weeks to take effect. Is there such thing as too late in the flu season to get vaccinated?
So I think, usually when we look at it, we can kind of see the peak of the flu come through and be gone. That's usually with the flu A, and then flu B can come around up to a month afterwards. So the answer is I don't know that it's really a too late. If you're seeing the flu season already come and gone, it's probably a little bit on the late side. And no, there's not a too early. So I know sometimes the local pharmacies will have the flu in stock in September, and getting that then is fine.
We talk about vaccination as a great way to prevent the flu, but there are some other methods too, like hand hygiene.
Absolutely. Washing your hands, using the hand sanitizer, those are the best things. Sneezing into the elbow, of course, can also be helpful rather than covering with your mouth, with your hand. So those are all good things. And, of course, the hand hygiene is the biggest one.
And so if those measures, despite your best attempts, don't work and you get the flu, people may wonder, is this something I can treat at home, or what are some symptoms that maybe, if they surface, I should see a provider?
Yeah, so there are a lot of people that can treat this at home. So, things like the Tylenol and Motrin just for the aches and pains and cough and cold medicines, that certainly is fine. If somebody's starting to cough up something that looks really bad, if they're getting really short of breath, they feel like they're always winded, that's a good reason to see a medical provider. Of course, anyone with those underlying lung conditions or congestive heart failure who's pregnant, really young kids, there is medicine. Tamiflu is one of those medicines, an antiviral medicine. It's not a great drug, but it's the only thing we have out there that actually fights the flu, so it can help reduce the symptoms by some degree. And so that's something that if in the first 2 days we start doing it, can help.
Very interesting. So there are antiviral medications like that are available, but like you say, it's not going to cure it instantly. It's not like it's not going to go away in 24 hours necessarily.
Right. I mean, the flu can last 7 to 10 days, and like I said, a lot of people feel like they're hit by a Mack truck. Some people get it much more mild, but those people who they just look like they're dragged through the mud.
And a lot of things do get referred to as the flu. I know you mentioned the stomach flu earlier, but what we're talking about here, again, it's really something that affects the respiratory system more than anything else, and that's not a system you want to mess with. Right.
So, I mean, certainly, shortness of breath. I see people when they have the flu, they can, to me, sound really wheezy when I listen with the stethoscope. They're going to cough. They're going to have typically bad headaches, muscle aches, and that sort of stuff. Sweating, fevers, absolutely.
Okay. Well, this is Ask Us Anything About the Flu from Penn State Health, and we've been talking with Dr. Jay Zimmerman live here at Penn State Medical Group-Elizabethtown. We thank you very much for watching. Anything else to add as we bring things to a close? Anything you want people to know other than get that shot?
No, other than we're still giving the flu vaccine in clinic, that's it.
All right, so get vaccinated, and we hope you stay healthy this winter season and this flu season. Thanks again for watching Ask Us Anything About the Flu from Penn State Health.